Chalazion. The plural is Chalazion. This is me, Dr. Hatem Khattab, a consultant ophthalmologist, Chalazion University, Egypt. Bismillah ar-Rahman ar-Rahim. Chalazion is a sterile, chronic, inflammatory lipogranuloma of meibomian gland. This is the linguistic origin of Chalazion. Concerning theory and pathogenesis, the primary event or the main problem is meibomian gland duct obstruction. This is an example of blocked meibomian gland duct. This is a comparison between blocked meibomian gland duct and the normal meibomian gland duct. What causes meibomian gland duct obstruction? Many theories exist. Fibrosis, dry secretion, epithelial debris, vitamin A deficiency changes in the epithelial lining of meibomian ducts. As concerns predisposing factors, many exist. Lifestyle factors like poor lid hygiene, stress of a known mechanism, local factors as chronic blepharitis, eyelid trauma or surgery, viral conjunctivitis can cause recurrent chalazion in children, systemic factors like seborrheic dermatitis, rosacea, hyperlipidemia, tuberculosis, and immunodeficiency. Previous factors lead to a retaining of irritating secretion that excites a foreign body granulomatous reaction. Concerning histopathology, there is central vacuolation surrounded with epithelial cells, lymphocytes, plasma cells, and giant cells with an outer fibrous capsule. Clinical features of Chalazion. Chalazion are painless eyelid swellings. Pain occurs if infected. Concerning the clinical signs, it is a firm, non-tender swelling related to tarsus. The overlying conjunctiva is red.
This video shows a very large chalazion of the right upper eyelid. This is a slightly atypical presentation. Typically chalazions are a little bit smaller than this. But what's a chalazion? A chalazion is when one of the meibomian glands, one of the oil glands in the eyelid, gets backed up. And what happens is you get a non-infectious granulomatous type reaction inside of the tarsal plate on the inside of the eyelid that can lead to swelling. Now typically we'll treat it with warm compresses and occasionally massage, and it will drain on its own. Now this one's so big that it has actually popped through and is draining on the inside of the eyelid. A little atypical, so went ahead, took this and cut it out and sent for pathology just to make sure we weren't missing a more serious abscess type infection or one of the masquerading cancers such as sebaceous cell carcinoma.
Watch more eye videos at routeatlas.com.
As regards the fate and the complications, it may resolve spontaneously. It may become infected, producing what we call acute chalazion or rhodiola internum. An example of a lower eyelid rhodiola internum and a upper eyelid, Hatem internal, an upper eyelid, infected Chalazion or Hatem internal, an upper eyelid, infected Chalazion, an upper and lower eyelid, infected Chalazion, infected Chalazion draining through the conjunctiva, an upper eyelid, infected Chalazion, upper eyelid, infected Chalazion. Chalazion may open at the lid margin, producing marginal Chalazion. Other examples of marginal Chalazion may open through the palpebral conjunctiva, opening through the palpebral conjunctiva, opening through the palpebral conjunctiva. Chalazion may produce mechanical ptosis if multiple and big like this. Chalazion may cause image distortion if big due to the induced astigmatism. This is the appearance of the image with astigmatism and without astigmatism. Chalazion may undergo cystic degeneration. What are the treatment options available? In small chalazion, do nothing. For larger and complicated chalazion, different options exist. Conservative treatment consists of warm compresses in cases with meibomian gland dysfunction. Eye massage or eyelid massage, gentle massage can help open the blocked meibomian gland ducts. Concerning surgical options, we usually produce incision and curettage from the conjunctival side through a vertical incision. This is a sequence of incision and curettage performed in cases of chalazion. The contents are scraped with a chalazion spoon. These are examples of the chalazion forceps used during the surgery. It helps to avert the eyelid, it protects the lid margin, and enables proper hemostasis. Many cases of them are performed under local infiltration anesthesia. Occasionally, we can use intralesional steroid injection, and in many cases, it produces good response. Marginal chalazion are shaped. For recurrent chalazion at the same site, an excisional biopsy is important to exclude malignancy. Acute chalazion are given medical treatment first in the form of antibiotics and hot fomentation and anti-inflammatories. For communication, this is my WhatsApp number and this is my email. This is my Telegram channel. Please like, subscribe, enable notifications, share and comment. Thank you and have a good night.